The Moses H. Cone Memorial Hospital has a new president. We'll tell you his plans for the first month, and we'll tell you how you can get involved in helping our youngest patients develop a passion for reading. Those stories and more in this month's Code View. Mickey Foster is the new president of Moses Cone Hospital. He was well known among employees at Annie Penn Hospital for taking off the suit and tie and working in various hospital departments. Look for him to do the same at Moses Cone Hospital, starting in housekeeping. Foster plans to work in 60 hospital departments in his first 90 days on the job.
My intent is to work in 60 different departments while walking my shoes in my first 90 days. I really want to come in here and focus on employee engagement. I heard that throughout my interview process and physician engagement, so I want to spend some real dedicated time my first 90 days with the employees and the medical staff to really make a positive first impression.
Foster says the Walk in My Shoes program allows him to get to know employees and the challenges they face. He comes to Moses Cone Hospital from Annie Penn Hospital, where Debbie Green becomes interim hospital president. After a year of planning and 6 months of training, the Neurointensive Care Unit at Moses Cone Hospital has become a combined neurotrauma ICU. The unit already provided care for trauma patients with brain and/or spinal cord injuries, but expanding the scope of the unit allows critically ill trauma patients to be cared for in one place.
It allows us to consolidate most of our critical care trauma education to a unit of nurses that will be taking care of these patients on a more consistent basis. It's been shown that in studies, places where nurses frequently take care of these patients, that you get better outcomes.
The surgical ICU is now the backup for the neurotrauma ICU. 4 years ago, 4.5% of patients with chronic obstructive pulmonary disease came back into the hospital within 1 month, often through the emergency department. Today, less than 1% do. That is because of new treatment guidelines put together by 19 different groups across Cone Health. Patients are asked about flu and pneumonia shots, called soon after leaving the hospital as a follow-up, and screened for other conditions that made them high risk. It's all an effort to improve the lives of our patients.
That's important because it gives them a much better quality of life. It allows them to feel better about themselves, that they are no longer having to rely on a hospital setting in order to get better. And for us as an organization, it helps ensure that we're doing the best that we can for our community as a healthcare provider.
The project received a Gold Touchstone Award at the recent Carolinas Quality and Sharing Day, put together by Carolinas Healthcare System. Patients at the Cone Health Community Health and Wellness Center may get help meeting prescription costs thanks to a gift from the Cone Health medical and dental staff. The staff gave $17,000 to the center.
The medical staff pays dues every year voluntarily, and we have been collecting these dues now for several years, so we had a surplus. And we gave our members a choice of charities, and given the indigent care situation in Greensboro, we felt that it was very important that we support this endeavor.
This is the first gift from the medical and dental staff. If you'd like to give, go online to conehealth.com/giving. Time to start training for the women's only 5K walk and run. The Greensboro Running Club opens its women's running school on July 31st. Registration is also open for the October 4th women's only 5K walk and run. Go to womensonly.com for more information. Few things open the world of opportunities for children like books. The Cone Health Inclusion Council is collecting children's books for Center for Children Patients. Shabazz Rabbani works in the Office of Patient Experience and knows the role books can play in a child's life.
As an immigrant and as a kid that came to the United States, I really connected with that piece of the book drive. To be able to see that from my personal experience, I think it's huge to be able to have access and resources and to be able to go to a place that is safe. Look for drop-off boxes near hospital cafeterias and other high-traffic locations.
The Cone Health Inclusion Council project runs through the end of the month. That's it for this edition of Code View. I'm Doug Allred, and I'll see you next time.